So I'm Dr. Al Yurvati. I have a medical degree and a PhD. I'm faculty at the University of North Texas Health Science Center, and I'm chair of medical education over there. So I started this journey about a year ago, transitioning from a cardiothoracic surgeon provider to a patient. But let me back up a little bit and tell you that I've gotten to know the people at the center here for many years. I've taken care of many of their patients by doing lung surgery, resecting tumors, biopsies, and putting in devices to include ports like I have for chemo. So I have a strong relationship with this facility and the people involved in it. About 7-8 years ago, my wife was diagnosed with a rare form of bladder cancer, 1 in 5 million, pretty rare. We didn't have to go to MD Anderson. We didn't have to go anywhere. We stayed here. She had a bladder resection done. Dr. Reddy, who's on staff here, took care of her, and we're going on 8 years now of being a cancer survivor on certainly a really bad cancer that, 1 in maybe 20, 25 chance of living 5 years, it's very low. So that was one transition. And then the next transition happened a couple years ago. She had a massive stroke. And so now I had to become from a provider to caregiver to take care of her, plus my surgical practice, my academic practice, and so forth at the same time. So that was a real transition. And then the third phase happened about a year ago or so. And I always kid around and say it's the Greek fates. The fates have a way to do this to you. But I then became a patient, which is interesting because now I'm on this side of the street. I've taken care of many of the patients, from the center, and now I'm a patient. And now I get to experience, the world-class efforts here. People ask me, why didn't you go somewhere else to get another opinion? And for your therapy, because, multiple myeloma is not curable. I've got the same protocols here that anywhere else in the country would have, and there's some other protocols that actually they're doing that are in clinical trials. So there's no reason, to go anywhere. I think the vision that the founders had to include Dr. Jordan, Dr. Fries, and Dr. Ross, who I know them very well, and taking care of their patients, of having one place that's a one-stop shop where you get everything done. So they have oncology here, they've got infusion here, they've got imaging here, you've got pharmacists, you've got support staff, and really good, certified oncologic nursing, to take care of you. So I feel very, very comfortable here. I don't like sitting still for hours and hours because this infusion that I take right now takes about 5 hours, but I'm learning how to deal with that. So it's a different transition now, that now I'm the patient and not the surgeon or the provider and experiencing the other side of the street. But what I want to reiterate is there's a comfort zone here. You're treated like family. They're very, very concerned about you, and they have really good success rate in that addition of the caring that they put in there. So this is the place I'm going to stay.